Hi everyone, welcome to my channel. Today I am going to deal with the topic tubes and catheters. So in this we will deal with the tubes as well as the catheters. So first one is the blood transfusion set. That is, as the name indicates, this is a set which is used for the blood transfusion. So what is the description of it? That what does it contain? So this blood transfusion set contains one filter inside the chamber in order to remove clots or small clumps of platelet during transfusion. So what is the use of these tubes? That is blood transfusion. It is used to transfuse the blood. So second is the endotracheal tube or the ET tube. As the name indicates, this is the tube which is been inserted into the trachea. So tube is placed inside the trachea through the mouth in order to provide artificial ventilation. So what is the uses? To establish and maintain patent airway and to prevent aspiration. So this is Foley's catheter. What is the use of Foley's catheter and what is the description? The description is this tube passes through the urethra into the bladder in order to drain urine. It has got two lumens, one for connecting the urine bag and one for the inflating the balloon. So what is the use of this urine tube, Foley's catheter? That is to drain the urine. Next is the IV set. That is intravenous set. As the name indicates, it is a needle inserted into the vein or the tip is connected to the cannula inserted into the vein. So what is the use? The use is for IV administration of fluids and drugs. So next is IV cannula. So what is cannula? Cannula is nothing, IV is nothing but the intravenous cannula. It is a medical device placed inside a vein to provide venous access. So next it is available in various gauze, that is from 14 to 24 gauze and orange to yellow in color and length is 19 to 44 millimeter. So composition and design based on this composition and design, it is available in various gauzes. So orange is the biggest cannula and yellow is the smallest cannula. The uses of this IV cannula is to create a venous access. So next is the laryngeal mask airway. So it is used to create airway during procedures and in emergency situation where ET incubation is difficult. So what is its uses? To create the patent airway. So next is the nasogastric tube. Nasogastric tube, as the name indicates, it is the gastric tube which is being placed in the gastric stomach through the nose. It is entered into the stomach via nostrils. The uses is to provide feed and medicine. Next is the Stenstaken Blackmore tube. It is a very important tube. So it is a three-way catheter tube with two balloons. One balloon is filled with will rest in the esophagus and other in the stomach. So inflated balloon helps to control variceal bleeding. This is a main tube, Stenstaken Blackmore tube, which is used for the variceal bleeding cases, esophageal variceal bleeding. So next is a pigtail drainage catheter. It is inserted with purpose of removing unwanted body fluids from organ cavities or abscess. Its locking tip looks like pigtail and it has got several holes which facilitate drainage. The main use to remove the unwanted fluids. So tracheostomy tube, as the name indicates, this is a tube which is placed in the trachea. Inserted in trachea via surgical incision on the trachea. What is the use of it? To create patent airway, prolonged in intubation, upper airway obstruction or inability to intubate. So next is the combi tube or double lumen airway tube. So the uses of it is a type of tracheal tube used in tracheal intubation during the thoracic surgery or to achieve selective one-sided ventilation to either right or left lung. So next is gastrotomy tube, also known as PEG, that is percutaneous endoscopic gastrotomy. So it is a tube which is placed through the abdominal wall into the stomach and it allows the nutrition, fluids and medication to be put directly into the stomach. So nasojejunal feeding tube, that is NG tube, it is used for long-term enteral nutrition. Enteral nutrition nothing but the gastrointestinal nutrition. Colostomy bag or stoma bag, or it is also known as ostomy bag. It is used to collect the waste from the bowel. So next is Bakri balloon. It is a silicone obstetrical balloon used to treat postpartum hemorrhage, that is PPH. Suprapubic catheter or SPC, it is inserted into the bladder through an incision into the abdomen a few inches below the umbilicus. So these are nothing but about the tubes and catheters. So please like and subscribe to my channel, and please follow me on the Instagram and Facebook.